am working in the field of musculoskeletal diseases, and I have a particular interest in the age-related skeletal diseases of osteoporosis and osteoarthritis. And I work in a laboratory where we are interested in looking at what happens to the actual tissue. So the joint tissue changes, the bone changes. So the presentation outline, I'm going to address these three questions. How to define your research question, the research process, and presentation of your research outcome. So I'm going to give you hints on all those three, and I'm also going to intersperse in my presentation some aspects of my own research project. So firstly, how to define your research question. Firstly, it's important for you to identify a research topic that you have a personal interest in. So the topic has to be something that you're quite passionate about. And this is quite critical so that you can maintain motivation throughout the research project preparation. And this will stimulate you to read and continually to read and gain knowledge and background to your research area. And as I put up there, as you obviously all know, the internet is a very powerful resource for you to search for information on your research project. So firstly, I had some overall questions to osteoarthritis that you can see up there. What is this musculoskeletal disease? How prevalent is it in our population? And are there treatments available to prevent development of this disease? So firstly, what is osteoarthritis? It is an age-related degenerative disease. A normal joint here results in loss of articular cartilage, and you get changes in the bone and a remodeling of the joint, and I'll talk about some of the symptoms of this disease. So what are the symptoms of osteoarthritis? Well, the joints, you can have significant joint pain, you can have stiffness of the joints after resting or inactivity. You can also have significant changes, or you can feel cracking or creaking in the joints. And it can result in actual inhibition of the function of that joint. So how prevalent is osteoarthritis in our population? That is Australia. It is the most common single cause of pain and disability in individuals aged greater than 50 years. And you can see up there how it's more prevalent in women than men. And you can also see listed there the direct costs and indirect costs of osteoarthritis in Australia are quite high. And the incidence of this type of disease and age-related disease is increasing because the population is aging, as well as we have a significant amount of obesity, which is a risk factor for progression of osteoarthritis, and also some of our lifestyle habits such as inactivity. So now we return to some sort of overviews of defining your research question. So you've identified a research area that you're really interested in. Now you've got to look at a specific research question you might want to investigate. Now to do this, you want to continue your knowledge building. You're trying to refine your search terminology now, and you're trying to acquire the most up-to-date knowledge of that research question. So for example, in this type of research, medical research, search engine is PubMed to get access to recently published articles internationally. So now turning back to my particular experience of osteoarthritis, I'm interested in what role bone plays, but I'm more particularly interested in the role that the early changes might be in osteoarthritis and whether they occur in the bone. And also, can we detect bone changes non-invasively? And therefore, the overall goal of the research is, can we target the bone to treat osteoarthritis? So we know from the non-invasive technique of MRI, that you can MRI image human joints, is that there are key features found in the bone, and these are the bone marrow lesions. Very importantly, they're present in persons that have pre-OA or very early osteoarthritis, i.e. they don't have any symptoms or significant cartilage loss. So the population studies suggest that these lesions may be very important in initiation and development of osteoarthritis. And the particular research interest is, can we target these lesions as an early treatment strategy for osteoarthritis? Which leads me to my specific research question. We actually don't really know what that MRI signal means at the tissue level. So if you actually look inside the joint, what is that signal telling us? And that is my research question. So now I want to move on to talking about a few tips about the research process. So for your research project, you have to have a think about what specific research methods you want to use in your project to provide you with some sort of answer or answers to your research question. So you want to think about what type of data or information do you want to collect. You want to know what previous studies have what in your research area, what previous studies, what types of methods they have used. And if need be, if you can't sort of come up with the right research methods, you might actually have to seek out local experts, and you can get in contact with, scientists or whoever you're interested in contacting by email, and many people will be happy to help you. Now returning back to my research project, because the study is clinically related, we had to seek out clinical experts to assist us with different aspects of the methods to the study. So the first one, you can see there, we had to build collaborations with certain specialists. So an orthopaedic surgeon was involved to allow us to have access to those tissue samples from patients having knee replacement surgery. We had to collaborate with MRI specialists, so the radiologists that allow us to perform the MRI at the Royal Adelaide Hospital, as well as rheumatologists, and these are individuals from Monash University in Melbourne who actually have conducted a lot of human studies looking at MRI in early OA populations and looking at people and how they develop osteoarthritis with time. And we're also collaborating with a clinical pathologist at SA Pathology to assess the changes in the bone marrow. I put up a slide here that once you've decided upon your research methods, you have to think about your research plan and your research project. And this will involve features such as defining your study, whether you're going to have what type of controls you're going to use. In these types of studies, obviously there's ethical issues, and you have to apply for ethical clearance in these types of studies. It's good to have a sequential sort of list of methods. So what sort of method are you going to do first and what leads to the next method? And also you need to think about how you're going to store and analyse your data. So finally I want to talk about how you're going to present your research outcome. So if you've performed a research project, you have the research data, so now what are you going to do with that data? You have to firstly consider how you're going to present that data. It depends on what type of data you have, and I'll give some examples from my research. So if you have numerical or quantitative data, you want to see whether you want to present it in a table or a graphical format. If you have qualitative data, so something that's descriptive, are you going to write about it, or are you going to present images to describe certain aspects? But most importantly, you need to identify what are your key findings of your research study. And remembering that both positive and negative outcomes are important. And then obviously you must return to your research question. So whatever you found in your study, does this data now actually allow you to answer that research question? And then further to that, you have to discuss your research findings. So for example, do your findings support the current view in your research field? It's always important to point out what limitations you have from the research data, i.e. how you collected it, did you have enough numbers? And then what recommendations can you have for the research field? So I'm going to put up a few slides here. I don't want you to take home all the messages from the research, but I want to show you what types of ways that you can present your research data graphically and pictorially. So we've MRI imaged some of the tissue samples from human knee patients. And all I'm pointing out here on the top two images is that we used different MRI sequences and we identified two different types of bone marrow lesions. So I've got a pie chart and it shows you that there's 25%, I think 25% and 50% of these bone marrow lesions fall into two different types, and then a fifth of the cases in that pie chart actually had no bone marrow lesions. So here I'm showing some quantitative data. Here I'm showing, again, back to some qualitative data. So I'm actually showing each case on a sort of cross-section through the sample here in the knee, and it's showing the position of those bone marrow lesions. And that's quite important because no one's shown that before, and it shows that they actually lie under really high loaded regions in the bone or in the joints. Now I'm just going to show you a little bit of quantitative data and how you can show that graphically. So here we've used that micro CT method, so we're looking at bone structure. And here you can see if you've got data that you might want to graph it in this way, and what we're seeing here is that the bone marrow lesions, the red and the blue bars, have more bone volume in 3 dimensions than samples that don't have a bone marrow lesion. And then the final little piece of data is looking at cartilage degeneration. So here we have some histology, which is showing us from this side to the other side how the cartilage is being progressively eroded away. And then again, we're plotting data in a graph, and we're showing that the bone marrow lesion that we detect on 2 different sequences has much more eroded cartilage than the samples that have no bone marrow lesions. So because this is a study in progress, I just put up one slide here just to summarise our key findings so far. And what we're finding is that if there's an increase in cartilage degeneration and changes in the bone, this is linked to the presence of one of these lesions. And they're actually picking up 2 different types of bone marrow lesions, and we think it might be an early and a later bone marrow lesion type in terms of early and late changes in osteoarthritis. And finally, the specific MRI sequence detection of these lesions might be able to be used as a biomarker to actually identify individuals at risk of progressive osteoarthritis and also perhaps to monitor therapy. So I just want to finish up by outlining what you really want to include when you write up and or verbally present your outcomes of your research project. And that is that you want to introduce your research project with the background so you can lead into actually what your specific research question is. You want to outline the research methods used, and normally that's a sequential process, so what you're going to do, from step 1 through to step 5, for example. And then when you present your research data, it depends on what type of data you have, be it numerical data, present it in a table, in a graph. If it's descriptive or qualitative data, you may be presenting it in a written form or an image type form. And I've given you some examples of that. And also, very importantly, you want to highlight your key findings in this, this presentation style. And then once you have highlighted those key findings, you need to discuss what you found in your research project. So does it support the current view of your research field? Have you found new knowledge? Do you have any recommendations for the study field? And it's always important to point out what limitations you have in your study. And it's also good to also point to what future research directions you might want to move into that field. So finally, I'd just like to summarise what I've talked about today. Firstly, and some of the main points. So the first point is it's important to firstly define your research question. And the most important point is that you want to identify an area that you are quite, you're interested in, you're passionate about, and this will help you with your reading and obtaining a background knowledge to your research areas. This is very important. It's important to select appropriate research methods, and if need be, you need to look for experts in the area, and people will be very happy to help you with that. And finally, when you present your research findings, it's important to highlight the key findings and also come back to your research question. So the research data that you've accumulated, does it actually allow you to answer your research question? Thank you.